Okay, so I am a second year veterinary student. So this is the lecture 1 on neoplasm or veterinary oncology. So neoplasm is a Greek word, is made up of two Greek words, neo and plasma. Neo means new and plasma means a thing formed. So a new thing formed. And neoplasm is a growth of new cells, which if any growth of new cells serve these three functions, then it can be called a neoplasm or a tumor. So those three conditions are: serves no useful function, has no orderly arrangement, and proliferates without control. That is, it serves no useful function. That division is of no use. That division of cells is of no use. Second, it has no orderly arrangement. That is, it can divide in any order in any direction and proliferates without control. Again, it can divide in any direction and without any control. There is no machinery to control the cell division. Okay. Okay. Now oncology, as it is has been written here, oncology. So oncology is the study of tumor or neoplasm. Okay. Now classification of tumor or nomenclature of tumor. So there are two types of tumor: benign and malignant. Benign, a neoplasm is said to be benign when it fulfills these three and one more, four conditions. Okay. So benign, a neoplasm is said to be benign when it remains localized, that is, remain at fixed at one place, do not spread to distant sites, okay, do not cause death of the animal or human, and can be surgically removed. Okay, so these are the simple meaning of benign tumor. Simple conditions there should be fulfilled by a tumor so that we can call it a benign tumor. On the other hand, malignant tumor, so when we will call a tumor malignant tumor or malignant neoplasm when it does not remain localized, that is, it spreads to other side, that is metastasize. I have written here, it metastasize. We'll study the definition of metastasis. Okay, it causes the death of the animal and it cannot be removed surgically. Because why it cannot be removed surgically? Because it is spread to so many parts of the body. Okay, next is components of a neoplasm. So any, whether benign or malignant neoplasm. Neoplasm means tumor. So any tumor, whether benign or malignant, we will study the conditions or differences between benign and malignant tumor here in this chart. But for now, any tumor or neoplasm, whether benign or malignant, is made up of two components, that is parenchyma and stroma. So parenchyma made up of supporting or neoplastic cells and determines the biological behavior of the neoplasm. Okay, so these are the actual cells which are causing the cancer, which are making the tumor cancerous. So these are the neoplastic cells, and thus they define the biological behavior of the neoplasm. On the other hand, stroma, it is host derived, made up of connective tissue and blood vessels, and provides blood supply to the neoplasm. Okay, so it is a supporting component. Okay, next is, in general, benign tumor. In benign tumor we add the suffix oma, and for example fibroma, chondroma, like this. And in malignant neoplasm or malignant tumor, if it is of epithelial origin, then we add the word carcinoma, suffix carcinoma. And if the malignant tumor is of connective tissue origin, then we add the word sarcoma. Okay, next is this classification of tumors. So tumors are of two types, broadly two types: benign and malignant. Wait. So tumors are of two types, benign and malignant. And benign tumor, first, it is of epithelial origin and it can be of connective tissue origin, also called non-epithelial origin. Second, malignant. So we will first discuss benign tumor. So benign tumor, epithelial of epithelial origin, of connective tissue origin, or non-epithelial origin. So epithelial origin, squamous epithelium, glandular epithelium. So squamous epithelium called papilloma, glandular epithelium called adenoma. Malignant tumor, carcinoma and sarcoma. Carcinoma, there is epithelial origin, and connective tissue origin, then sarcoma. Very simple, very basic. Okay. Now these 2 points are very important. These are always asked in the exam in one definition, 1 marks definition. Sorry, dermal cyst tumor and teratoma. So dermal cyst tumor, it arises from an embryonic defect in growth. It is composed of only ectoderm and it contains dermal structures, that is teeth, hair, dermal structure, etc. And teratoma, it arises from embryonic defect in growth. Again, it arises from embryonic defect in growth, just like dermal cyst tumor, but it is composed of 2 or more germ layer. And it types of teratoma, there are 2 types of teratoma, benign and malignant. So when all the components are differentiated, that is, we can differentiate different types of cells present in that neoplasm, then the cells present in the tumor are similar to the body cells, then we can call it benign. And when they are less differentiated, that is undifferentiated, then we can call it malignant. Okay, now there is one more kind of neoplasm or tumor, that is called mixed neoplasm. And mixed neoplasm is composed of fibrous tissue, cartilage, epithelial tissue, bone. Okay, for example, neoplasm of mammary gland in bitch. So this is the basic example. Okay. We will now study the macroscopic appearance of a neoplasm or tumor. So a neoplasm have no definite shape, size, color, consistency. Okay. Shape, if we talk about shape, then it is a slowly growing tumor is of spherical shape or pedunculated shape. It will have various, we can say, um, what do we use? It will be a spherical shape, somewhat spherical shape, and rapidly growing tumor will be multilobulated. Okay. Now color, if there is melanin present in the tumor, then it will be black in color. If fat is present, okay, I wrote at instead of fat. Okay, I wrote at. So if fat is present, then it will be of yellow color, and if hyperemic or hemorrhagic condition is present, then it will be pink or red in color. Okay. Now consistency. Tumors of bone are very hard. Obviously, bone is a very hard tissue, so its tumor will be very hard. Tumors of connective tissue are fibrotic or sclerotic in nature. Fibrotic means it consists of fibrous tissue or sclerous tissue. Okay, hard tissue. Now microscopic appearance. So benign neoplasm. So and malignant neoplasm. So if we talk about benign neoplasm, then cells are of adult type, and malignant neoplasm its cells are of immature or embryonal type. Okay. Now the question might arise here that, for example, suppose that in any adult animal or human there is malignant neoplasm seen. Malignant tumor is seen in any adult animal or human. Okay, so the human or animal is in its adult stage, so it means that the cell must have become adult by then. So why are we saying that the cells in malignant neoplasm in an adult animal or human are immature embryonal cell type? It is because of the process of anaplasia. So anaplasia means reversion of cells to a more primitive or undifferentiated form. So cells which are of adult phase, which are in adult phase, they will become more and more they will become more embryonic or immature, and the more the anaplasia seen, the more malignant is the neoplasm or tumor. So that is the characteristic of a malignant tumor, that is the more it anaplasia, that is more reversion to the embryonic or primitive undifferentiated type, the more is the malignant is the neoplasm. Okay. Now anaplasia is characterized by nuclear cytoplasmic ratio 1:1, that is nucleus size of nucleus is extremely enlarged, enlargement of nucleolus, since nuclear size is enlarged, to nucleolus is also enlarged, and embryonal cell types, anaplasia. Okay, so one of the most important questions of long questions in this oncology unit is differences between benign and malignant tumor. By the way, this is veterinary pathology, not veterinary medicine. I am a second year veterinary student, by the way. So benign and malignant tumor. So we'll discuss simultaneously both points. So benign tumor, slow growth over a long period. It grows slowly, which continues for a long period of time. But in malignant tumor, the growth is very rapid. Few days or a few weeks, it will grow completely. In benign tumor, the growth is only by expansion. The tumor will only expand in the sides, or it will expand through the sides. But here in malignant tumor, it will grow by expansion and infiltration. That it will penetrate different tissues, other tissues. In benign tumor, do not penetrate the basement membrane. The cells which are growing, they do not penetrate the basement membrane, and in malignant tumor, they penetrate the basement membrane. In benign tumor, there is limited growth. In malignant tumor, they do not stop growing. In benign tumor, the growth is limited and slow growth. But in malignant tumor, growth is very fast, and the cells do not never stop growing. They always continue to grow. They do not metastasize. In benign tumor, there is no metastasis. Now, what is metastasis? So, metastasis is defined as the formation of secondary growth which is discontinuous from the primary growth. That is, somewhere there is, if suppose that there is some malignant tumor which is being formed somewhere in the body of animal, so that will form, and once that tumor will fill up all the space that is present there for the tumor, then it will start breaking off, and then those cells will, through blood circulation or any other hematogenic route or body cavity seeding route, any route seeding through body cavities, that we will discuss in next lecture, by the way. So it can, through any route, can get transferred to any part of the body and can start a new tumor there. That is why it is so difficult to treat malignant tumor, and that is why it is cancerous. Okay, so malignant tumor always metastasize, and benign tumor moderately well formed blood vessels, and malignant tumor numerous thin walled blood vessels seen. Okay, in benign tumor there is very little destruction of adjacent tissue, and in malignant tumor obviously there is huge destruction, abundant destruction of adjacent tissue. Why? Because it is always growing by invasion and penetration. Okay, and it always competes with the normal tissue for its growth, development, and nutrients. And anaplasia is not seen in benign tumor, obviously, and anaplasia always seen in malignant tumor. So this is all about the first lecture of oncology.